Lindy. I am a 48-year-old mother of 4 and I beat breast cancer back in 2021 and I am having my DIEP flap reconstruction next week. Finally, after 2 years of waiting post-finishing treatment, I have finally got my surgery. So today I had my pre-op appointment and I thought I would go through that with you and let you know what we discussed. Okay, so she told me that the surgery is going to be a 6 to 12 hour surgery and it is not dangerous at all. It is completely surface level, away from organs, because I've been freaking out about it because it's such a big surgery, but she said it really is a simple surgery. I go straight to a ward. I do not go to ICU at all. I'm just placed right next to the nurse's desk and they monitor me hourly for the first 24 to 48 hours. And then from that, I go back to ward standard, which is 4 hourly. Generally, I'm not going to have any visitors after surgery until the next night. So I go in on the morning at 6 a.m. and we'll have surgery at some time that day. I'm not sure what time. And then I can have visitors the next night. So the theory behind this is that I'm just going to be exhausted the first night and really not going to be aware anyway. And then the next day, plus the first day as well, the nurses have things to do. They've got to clean me up. I've got to get up myself. I've got to have a shower and, there's things I need to do. So they want to have all that sort of done before I have visitors arrive. But of course, if I have family or friends that do want to come and check on me on the night of the surgery, then that is allowed. I'm not sure if I'm going to want that or not at this stage. So I won't have a PCA after surgery, which was what I was told would be the plan. Apparently the surgeons don't like to do this as it increases drowsiness, which can increase my risks for pneumonia and chest infections. This is because my surgery is going to be so long and your lungs aren't working on their own for that long that, yes, so I will have a lung expander thing where I blow on, which will help expand my lungs over the next week past surgery. But that is to help to prevent pneumonia and chest infections as well. I will be in surgery. I will be in hospital for 5 to 6 days. She said definitely 5, but if I feel like I'm not ready at 5 days, then I can ask for a 6th day. And I will go home on endone and simple analgesia at that time. I'm going to have 3 to 4 drains, 1 on each side of my breasts and 1 on each side of my stomach. These will be removed once they are draining less than 30 mils a day. I will have an IDC catheter in, so I don't have to go to the toilet for 2 to 3 days. So I'm looking forward to that part because, yeah, imagine having to go to the toilet after going through all this. They will get me out of bed the next day after surgery. So I'll come out of surgery and spend that whole night in my bed. The next morning, physio are going to come around and get me to sit on the edge of the bed. I forgot to ask about walking, but I'm assuming that'll either be that afternoon or the next day at least. I do have 7 stairs here, so I will speak to the physio and we will work on that while I'm in hospital. I will have to get a pillow specifically for holding on my stomach for when I'm doing stairs and things like that, because to hold on to my core. I have to remain in a sitting position, even with sleeping, with pillows behind my back for the first 4 to 6 weeks. I'm going to hire a toilet chair, but just because the toilet's a bit lower and I just want to make it a bit easier for myself. With my sitting position, that is to also go with small, short walks around my house and even get out to the shops and do some window shopping and stuff like that. Just small little walks to that couple of weeks. Driving is 4 to 6 weeks. Everything on the internet told me 2 weeks, but it's 4 to 6 weeks. But really, ultimately, it is based on how much pain you have going from the accelerator to the brake and moving that leg. If you can move that comfortably, then that's the main issue. For dressings, I do not touch anything at this stage. They will replace my tapes at my 10-day appointment, and then I have appointments every 2 weeks depending on wounds, if I need to go sooner or not. And they will look after all my dressings at that point. I do not need to buy anything for that. And just to not use my core muscles for 4 to 6 weeks. So that includes no cleaning, no shopping trolleys, no bins, no mopping the floor. That's all for someone else to do. What I still need to organise is pre-cooked meals, which my daughter is going to help me with, undergarments. So I am getting pressure compression garments. I have an appointment booked for Wednesday that I'm going to go in and do that. Likely I will take you along. And that is, I will have a compression pants and a compression top. I'm going to get 2 sets, and I am to wear them for 6 weeks straight. They don't want me to work with COVID patients. They want me to keep myself safe, of course, because we do not want anything to prevent this surgery. I have spoken to my boss, and we're definitely moving me out of the front end area and any areas that are secluded for COVID. And yeah, we're working on what we can see. Ultimately, I am a nurse and I have to do my job, and I understand that they're going to do everything they can and they are going to help me. But we do have N95, we have gloves, we have all the protection that I need to protect myself, and ultimately it comes back on me to make sure I'm protected from anything respiratory prior to surgery. I do have a anesthetics appointment next week, and then that is my last appointment till surgery. I go into ED at 6 a.m. On my day of surgery, and then they will transfer me from there. I have to increase my fibre intake, start drinking pear juice, eating prunes, taking Coloxal and Senna, anything like that, because basically I need my bowels as soft and workable as they can be, because I'm going to be full of opioids and it's going to be extremely painful to open my bowels, and I'm not allowed to leave hospital till I open my bowels. So we want to make them as soft and regular as possible going in before I even start the opiates, so that hopefully they will have the right effect. Okay, so I have to get my bloods this week, which is just your general FBC Chem 20 type bloods, and then the day before surgery I have to get my grip and hold. I was going to go on a cruise to recover. Just the last week of my 8 weeks off, we were going to go on a cruise just to recover. I knew I wasn't going to be able to do any activities or anything like that. It was just to relax, but I've been told no, because of course a cruise is a cesspit of infections, which I wasn't thinking about that. I was just thinking about the relaxing, having a good time part. 12 weeks I'm allowed to go. So whether I go on a cruise or whether just I go for a short trip down to Sydney or up north or somewhere that I haven't been actually, so I've already been to Sydney, but I'll think about it. 12 weeks post-surgery, I'm going to go for a little trip. Okay, for my surgeon, I still have to let him know that I often wake up very, 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 extremely, very sick. To the point that they've given me all the antiemetics and I'm still just vomiting and vomiting and vomiting. So I have let them know. I don't know why this happens, because sometimes it happens and sometimes I wake up completely fine. I don't know if it's a different anesthetic. I don't know if they are putting it into my system differently. I don't know, but that happens and I have to let him know. I also have to let him know I do not want a belly button. I have thought about this, and I've thought about this a lot, and I don't want a belly button because I just don't like the look of reconstructive belly buttons. I mean, fair enough what you want, but for me, I'd rather have no belly button because, and ultimately, because I've got 3 fingers, and then if I have no belly button, I can literally say, am I even from here? Was I hatched? Am I an alien? And it's just too good of an opportunity to not do this. And I will never regret not having a belly button. It will always be my party trick to go along with my hand. And I want to know how many surgeons I'm going to have at one time, because I've been watching YouTube videos, and I saw one and she had like 4 or 5, 6 people working on her at one time. It was like, wow! Like, I just want to know how many teams I've got. Like, I know it's going to be a lot because I've got a plastics team and a microsurgery team, and one's going to be working here and one's going to be working here, but because I'm getting both sides, am I going to have 4 teams? And also, lastly, I'm going to ask if I can leave my camera with them and they can record whatever they want and whatever they're allowed to do, because I think that would be awesome to get it behind the scenes, especially like when I'm waking up. So, that would be very, very interesting. And yeah, that's pretty much it. So I just have those few little things to organise, which I really need to get organised, because I really only have this week, to be honest, because I had to bring my shifts forward so that I didn't have to take holidays for 2 days type thing. Anyway, that is my pre-op appointment. I feel much, much reassured. Honestly, the last couple of days I've been feeling sick thinking about surgery. I know I'm a nurse, but I'm not the patient, and it just makes me sick feeling about being the patient. I do worry about dying, going under anesthetic for such a long time, but then I reassure myself that I honestly have more chance of dying going to work or driving there in a car accident than I do of dying in surgery. Recovery, I will get through this. as you have all said, I am strong and I have been through a lot. I have had a double mastectomy, a lymph node clearance. I had complete and total hysterectomy. I've been through chemo and had radiation. Absolutely, I can do this. I know I can. It's just a couple of weeks of pain and then I will have the body. Actually, I won't. I have to go for revision, but then I will have the body. Anyway, I hope this was helpful to let you know what was happening, coming up, and what they expected of me pre-surgery and post-op. Talk to you soon.